Hello, my name is Martha Liz Tavoas, and I'm with the Women's Soccer Puerto Rican National Team. And I was in World Cup preliminary games in Trinidad and Tobago. And the second game, I was playing against Haiti, and I was tackled from behind, and instantly, as I was on the ground and I was trying to get up, I knew that something was going on with my knee. And as an athletic trainer, I knew that it was probably my ACL. So while I was in Trinidad and Tobago, I had Dr. Borden's number because he had worked with one of the athletes at Dominguez Hills with their soccer program, and he did her surgery. So I found out how amazing her progress was and how great his team with therapists were. So I wanted to make sure that I talked to Dr. Borden. So I gave him a call in Trinidad and Tobago, and I was like, Dr. Borden, I'm pretty sure I tore my ACL. I'm like 95% sure. And he's like, okay, well, when do you come back into the States? You know, we'll get you into the office. Don't worry about anything. We'll take care of you. And coming from a professional athlete, knowing that you have someone behind you and able to give you that security that everything's going to be okay when something so traumatic has just happened, you kind of feel at ease with everything. That following week, I received ACL surgery with my patella tendon graft, and it was probably it was surreal, the experience, being able to have a great doctor behind you, knowing that he cared about you and being able to push you through things that you wouldn't ever think that you would be going through. And having him and his amazing team of physical therapists really helps you appreciate the work that they do. You know, it's kind of scary knowing that you have such a big thing going on, and you know, it's your body, and you wouldn't ever think that you would go through something so traumatic. And just having the ability to have a doctor with amazing credentials, feel like he's your friend, and knowing that he's, you know, going to do the best job that he can, really makes you feel secure and know that everything's going to be okay. No soccer player wants to know that they tore their ACL. Like, their knee is everything to them in the sport, and knowing the rehab that you have to go through 6 to 8, 9 months, maybe sometimes a year, depending on different individuals, it's like you kind of go in shock and you're like, oh my gosh, my world's crushing down on me. But yeah, knowing that you had someone there, an amazing doctor, to be able to help you and push you through the things that you yourself can't imagine going through by yourself, and knowing that he has wonderful surgical techniques, makes you feel at ease and happy, and knowing that you have someone there that knows what they're doing and be able to help you the best. And after surgery, it was hard. You kind of forget how easy it is to walk, and when I got out of the surgery room, it was like I had to learn how to walk again. I had to learn how to sit down again. So it was a challenge, but you always have to remember to keep your head up and keep moving forward, because it's just one step at a time and one milestone at a time.
Martha participating in light impact agility exercises. And Martha's doing a quad stretch. She's able to get her knee through full range of motion, which is important. At this point, a lot of people aren't able to get their full flexion at their knee that they've injured.
Squat hold.
Thighs are good.
Come on, little guy, you can do
So
it.
Martha's in a squat position on an unsteady surface, which really kicks in her quad muscles or hamstrings or VMO to improve proprioception in her right lower extremity and left lower extremity, so when she's able to return to higher impact activities, she'll be able to do that.